Pleasure to be here together with other journalists from the Asian countries. And I just thought that I'd just, sort of, if we could observe about a minute's silence uh, in memory of those who've lost their lives, reporting from the front lines of the pandemic, that would be a good way to start. If that's okay with everyone. Just a minute's silence. Sunny, if you will keep the time. Is that okay?
Yes. Okay, Jaya.
Can I have the next slide, please? So it's been quite a while, more than a year has passed since we've been dealing with the pandemic from the front lines. And according to the Institute of Perception Studies in Delhi, they've come out with data recently, just a few days ago, of the verified number of deaths due to COVID-19 among journalists is being somewhere in the region of about 238. These are the verified deaths, confirmed cases, but we don't know how many more are out there who've gone uncounted. There's probably a good number, particularly from the rural areas, that we know nothing about. In Bangladesh, there's been about 52 to 56, according to the Press Emblem campaign data. Nepal is still, I think, below 10, but probably Surendra will be able to give us throw more light on that. And similarly, Sri Lanka, I have not much of an idea. Looking forward to hearing from Amanda. But next slide, please. It's going to be something that's going to continue. We're seeing death rates due to COVID-19 climbing in Asia in a way that's much in contrast to what happened in the first wave, and this is what is happening. There's a higher rate of death happening in the second wave in countries all over the world. Asia is no exception. Only thing, the Asian numbers are pretty startling to look at, and Ranjit has been talking about that a lot. Partly because India is a massive country with a huge population, immense vulnerability factors that pervade all the states. We've been going through varying levels of response across the states. Health is a state subject. The states have their own ways of dealing with it. And we've seen the introduction of, next slide, please, of variants. We don't know exactly at what time these variants have been introduced, but suffice to say that whenever a new variant has been detected, no matter the country, here are three examples: India, Brazil, and South Africa. A study by, Caprisa has contributed to this. We've seen, wherever there's been the introduction of a faster, more transmissible variant, possibly with the opportunity to cause a more severe type of infection, that introduction has been followed by a spike in cases. The jury is still out on whether it is, definitely the volume of the second wave is linked directly to these variants. There are several factors in place that have contributed. In no small part, it's been large gatherings that have happened in India. One can talk about the electioneering that happened. We went ahead and had state assembly elections in 4 states. There's been large religious gatherings, and the public have not been consistent in their observance of the COVID appropriate protocols of mask wearing, hand washing, and so on. There's also been varying levels of vaccine uptake, partly due to the availability and partly due to hesitancy on the part of the public. So all of these have, contributed to a sort of disaster cocktail where we're seeing a spiking of cases across the Asian countries. Next slide, please. We're also having to deal with another important aspect, because the new variants do seem to have some kind of, a varying response to the vaccines. And if you look at the vaccines that have been made widely available across Asian countries, also through contributions by India to Nepal, to Myanmar, to Afghanistan, to Sri Lanka, and so forth, you'll see that the AstraZeneca, which was sort of produced in bulk, has far less efficacy against some of the variants that are in circulation, and this is just the beginning of our understanding. The next slide, please. Sunny, may we have the next slide? Yeah. And as Ranjit was mentioning a few minutes ago, we're seeing an epidemic within a pandemic in India. India is already, sort of known as the diabetes capital of the world. And there are varying levels of immune competence in the population.
It's 4:45.
Depending on our, immune status due to malnutrition and diabetes in no small part. And here are a sort of a short list of reasons as to why we're seeing this epidemic. We were already contributing to about 40% of the global mucormycosis or black fungus burden, which was not much talked about because it was such a small issue in a sense. But now we're seeing, it as one of the faces of the COVID-19 pandemic. There's been, indiscriminate and inappropriate steroid use at the wrong times. In India, steroids are available over the counter and they're very cheap. And people who have just read the word steroid in the media in association with treatment for COVID-19 have been literally buying and dosing themselves, either as a protective measure, which was the worst thing they could do, or in the early stages of infection, which is an even worse thing, because it would have suppressed the immune system and allowed the virus to spread quicker in the body in the early stages of infection. Steroids also end up raising blood sugar levels, and that might have also contributed to the growth of the fungus in the body. Strangely enough, ironically enough, our bid to sort of improve the oxygen supply led to the government of India calling on the industrial use oxygen manufacturers to sort of end up supplying medical oxygen. And in the industrial manufacturing oxygen units, there's not always sterile or aseptic conditions that are, sort of followed, so that we might have ended up supplying oxygen in cylinders that were not cleaned properly, unlike the medical oxygen cylinders, and that might have contributed to the epidemic as well. And in most parts of India, there's a delayed diagnosis, a hanging back. We don't know what the scene is like in the rural areas. And, a delayed diagnosis, delayed care seeking may have also contributed to this pandemic, epidemic of black fungus. Next slide, please. I'd just like to flag up very quickly what is our readiness for vaccine acceptance and capability of the government to sort of roll out large vaccination programs. And if you look at the 4 countries that we're talking about now, they're in varying levels of preparedness. Next slide, please. And this is what the last slide I have. Moving forward, as we know, we've been going through a lockdown, open up kind of a yo-yo strategy in the Asian countries, locking down when there's a spike and opening up again when we get complacent and think that the cases are going down, and then moving into a next stage of lockdown when the cases start climbing again. And over time, this is going to lead to a sort of a staggered impact on the economy. And here's a sort of a rough look at what it might be looking like post-COVID as we come out of the pandemic. This is something new that we haven't seen before, this kind of an economic recovery. It's known as the K-shaped recovery, where you're going to see some parts of the population going further down the socioeconomic scale, and certain others are going to thrive or do even better. So you can see the kinds of industries that are going to do better and the kinds of workers that are going to do worse. And the reason why I flagged up these last 4 or 5 slides on the variants, on the black fungus epidemic, on the varying efficacy of vaccines, on the vaccine preparedness, and then on the economic recovery. The reason why I put these 5 slides here is that journalists have a huge task ahead of us. We're going to have to keep reporting on these issues as they, sort of roll forward. And there's going to be a huge demand on us to capture these stories of the economic impact, of the vaccine rollout, of the new variants, of vaccine efficacy, and of how governments are going to meet the demand and what manufacturers are going to do and how they're going to get distributed. So it's just to say that this very high-risk situation for journalists in the Asian countries is going to continue for some years. And in the meantime, how are we going to keep safe? How are we going to stay cheerful? How are we going to stay centered? And above all, how are we going to stay, protect ourselves from both illness and death and protect our families as well is a question that I hope that this webinar will try to answer. So thank you so much for your attention, and back to you, Sunny.
Thank you very much, Dr. Jaya. I'm Sunny Krishnan, and I'm also a pandemic mentor with Internews. And right now, there's it's great having all of you here, and journalists have been in the forefront of covering COVID-19, and they're paying a heavy price, as what Jaya said, due to the virus. And to quote, according to the Delhi-based Institute for Perception Studies, slightly updated with the figures, it's 288 journalists, bordering on to 300 journalists in India that have died from COVID. This is from the period of April 2020 to May 16th, 2021. But there could be more, as Ranjit was telling us earlier, in the rural areas, and unreported deaths and all that. So, and journalists in South Asia are navigating through very dangerous conditions to bring the human side of the story onto the public. And without their efforts, we wouldn't know how much the community is suffering. What are the lags? Where is the data? Where's the lack of data, etc.? Okay. Without much ado, I'll pass you over to Ranjit. But before Ranjit comes on, and here are a couple of housekeeping rules. When the speakers are speaking, please mute your mics. Yeah, we don't want any background noise to creep in. Okay, a bit on Ranjit Devraj. Ranjit is based in New Delhi, and he's a consultant editor with ScienceDevNet. Prior to joining ScienceDevNet, he was the Asia Pacific editor for Interpress Service. And prior to joining Interpress Service, he was a correspondent with the official Indian news agency. So on to you, Ranjit. Thank you.
I think, if you talk about data, now this is a huge issue in India because the present government has been fiddling with the data, all kinds of data, ever since it came to power. So much so that the economic indices that we have, they're all so messed up that nobody knows what's going on. See, we had, even before COVID, we had some pretty catastrophic events like demonetization and the rollout of GST and things like that. So there was already a shock to the economy that started then, which sort of got exacerbated by COVID. Now, what did they do with the COVID? They suddenly imposed a lockdown, and they gave 4 hours notice for people to just wind down whatever they were doing, shut shop and go home. But where's home? For millions of people, home was like maybe 500 to 1,000 kilometers away. And so you have millions and millions of laborers who, now all this is undocumented. See, I'm talking about the statistics data part. If you ask the trade unions, they tell you that there are 200 million internal migrants in India. People moving from one state to another. People also from other countries like Nepal, for example, or even from Bangladesh. A large number of people from Bangladesh who are not even documented. I mean, that's a separate story, or they have the CA, trying to document citizens. But the point is, the economic fallout of all this activity, of the lockdowns, is never quantified properly. So that is why now the Senate government is very reluctant to talk about a national lockdown, although we are virtually on a national lockdown at this point in time. So now that's one thing, the economic side. The other side is the deaths. How many people have died? How many people have fallen ill? We don't know. When you talk about hundreds and thousands of bodies floating in the rivers, you know that nobody is documenting them. They don't want to document. They don't want to see it as a failure because it might affect their chances of returning politically tomorrow if there is an election. In fact, they lost the last three important elections in West Bengal, Tamil Nadu, and Kerala. I won't say it's because of COVID, but certainly COVID had something to do with it. It exposed the government as being terribly, terribly incompetent. I mean, I'm not being politically. I'm just saying that when you see incompetence, you know incompetence when you see it. You know ineptitude when you see it. You don't need to, when there are, there's shortages of oxygen, shortages of beds, shortages of vaccines, and absolutely nobody in charge anywhere. You're on your own. See, most people in India, they function on their own. You're there, you look after yourself, you spend your monies. And those who haven't got the money just perish. And that's what happened. There's no sort of disaster preparedness. The data on disasters is like, it's just, sort of, they were walking in with their eyes wide open. That's what happened. I'm talking about the second wave, really. The first wave, okay, we are lucky. Maybe a lot of, the lockdowns helped limit the. Look at those. Those are actually bodies. You see those orange spots on the sand. Each one is a body. It's a corpse, just covered with a saffron shroud. They're used as a shroud. Now, all the government, this is in UP, all the government, Uttar Pradesh, government did was to order the saffron shrouds removed so that the bodies cannot be easily, spotted. Or maybe there's something to do with they didn't want the saffron color, which is the Hindu religion. There's that thing in the UP. There's huge polarization between major communities. So they're concerned about those things. They're not concerned about containing the epidemic. And that is what has exposed people. People, and then the vast amounts of poverty engendered by all of these demonetization, the sudden lockdowns, the extended lockdowns, the loss of jobs. There are estimates that some 300 million jobs just vanish. Whether they're big or small. Companies folded up. All those startups and everything that they were talking about just simply folded up. So, this all, of course, if you have an epidemic of this sort, you can't get away from lockdowns. But these have to be, timed properly. They have to be calibrated. They cannot be a blanket thing cutting across months. If you do that, you're going to pay a price for it. And we are paying the price for it now. And we are continuing to pay because we don't know the cause of this disease. Of course, some of it has to do with the fact of mutant varieties. This is a peculiar virus. Maybe it is engineered, we don't know. But they, engineered to mutate fast. So the problem is that the longer you have the epidemic, the greater the chances that the virus mutates. These are things that are very well known. It's easy to understand these things. But which means that your priority should be to vaccinate as many people as possible. You forget about the herd immunity. That's not happening. It doesn't work. After Sweden, we know, or UK, we know it's not going to happen. You need to vaccinate. India has the capacity. It's how you plan to make use of that capacity. You have to put your money where your mouth is. You have to give out those orders to manufacturers. Go, here's the money, make as many vaccines as you can. Had they done this with the Serum Institute, it would have happened. Even with biotech, and there are so many other vaccine manufacturers. Or import them. Who's stopping you from importing them? The central government says the state should import them. They are absorbing this very responsibility in the matter. So, this is about when you have a pandemic in a large country like India with limited resources, you just have to be extra careful. You can't bury your head in the sand and pretend that it will somehow go away and everything will blow. People do that in India. Whether it's demonetized or whatever. You wait long enough and the problem goes away, or they are replaced by newer and worse problems. But this is a persisting thing. We're running for 1.5 years and we don't know how much longer it's going to run for. So the best thing, the important thing that you can do is quantify, have the right data, which is what will help you to manage. Now, if you fudge that data, you will pay for it. Without data, you're lost. You can't do anything. And then I also talk about the NGO sector. The NGO sector, the voluntary sector, the civil service organization has simply evaporated because the government's policies against NGOs. They said we don't need NGOs that are supported by with foreign funding. So thousands of NGOs just shut down. All this happened 2 or 3 years ago. So that all the legal NGOs or the gender NGOs, all of these things just wound up, shut shop. Organizations like Greenpeace were told to go home, or Amnesty said you shut down get laws. So if you do that, there will be no one around to help when there's a disaster. Then the NGO said that's just not there. So, and they would have helped us find the numbers, how many people died, or how many people fell sick, how many people went to the hospitals, how many people were successfully treated. So the government, it's sort of hiding away from anybody who can expose them, whether it's the media or the NGO sector or whoever. It's a peculiar situation we are facing in India. They're helpless. People are helpless. They've been rendered helpless. They can't even help themselves. That's the situation. So that's as far as data is concerned. So any data that comes out of India is suspect. I think that one of the best estimates that I've seen is one that talks about 1.5 million cumulative deaths by the beginning of September. That's the best I can really think. It could be 5 times the official numbers, maybe 3 times or 5 times. It's certainly in multiples of whatever number they are putting out now. That's as far as data goes, Sunny.
Sunny, you're muted.
Sunny, can you hear me?
Yes. Thank you very much, Ranjit, and right on time. Thank you. Much appreciated. And if you have questions, please throw them into the chat box below your screen. We've already received a question from Vichy, which is sent in yesterday. Thank you very much. A very important question, 2 important questions. And without much ado, pass on the floor to Dilrukshi Handunnetti. And Dilrukshi is the executive director for the Center for Investigative Journalism in Sri Lanka, a really close friend, and she's well known to the gender and livelihood circles in the region. So on to you, Dilrukshi. Thank you.
Thank you, Sonny. I think Ranjit prepared the backdrop for most of us coming from South Asia, because we probably have very similar stories to tell, despite the scale of the issue and the size of our countries in terms of territory. Right now, we are in lockdown, and it got extended up till June 7. This has also created more discussions as to what is the basis on which that we actually go into a lockdown, and this is also because people have been clamoring for one. There was this upsurge in the numbers, this high rate of infection that was getting recorded in Sri Lanka, and there was this theory that was floating about that you have to learn to live with COVID, and it's not a question of controlling it and curbing it. It's that people have to, this is your new normal, so you've got to live with it, and you have to start working and leading a normal life as possible. But then there is also complacency that can be set in, because we have also held an election, a very important parliamentary election last August. And we were priding ourselves because very few countries had the courage to do so. And after South Korea, Sri Lanka was holding an election at that scale. and just a few months after a lockdown and the full impact of a first wave. But now we are in the third wave. And as you speak about the second wave and the potential of having to face a number of other waves, I think if we are missing out on the lessons, one of the key lessons probably would be the fact that how do you get your system in place? How do you learn to respond to an emergency? We have never lived through this kind of pandemic before, so we don't have human memory to go by and learn from. At least none of us do. So if we went through the pandemic conditions last year, getting the system in place, getting your vaccination program in place should have been the priority. And these are two things that the professionals today are speaking about. One thing, getting the system ready. And part of that getting that system ready also includes making this country vaccination ready. So, you need to pledge more money. And we have just, I guess right now we are in this crisis mode. So we have placed an order for Sinopharm, a large quantity. And instead of that, the government has been placing orders for luxury vehicles for parliamentarians. So this has really brought a hell of a lot of criticism against the government. And instead of preparing people for vaccinations, because any country has anti-vaxxers, and this is also true of Sri Lanka. And even then, vaccination literacy and awareness as to what works and why, and the efficacy, how do variants work, what's the importance of understanding that, why is it that Sri Lanka is now recording 6 variants, and what does it mean to real people out there. These things have to come through discussions and debates that are driven by professional people. But we see less and less of professional people, the medical experts having place and the opportunity to make decisions or to speak about these issues in the public domain. What we see in this country is more and more people getting disillusioned and unhappy about the space they have to push for a professional solution. A case in point is now we have travel restrictions. We are in lockdown. So whether it is being used to identify clusters, whether we have clusters or we have community spread, it's all a blur because we are also data deficient. And what about the trends? How do we isolate? What is the reason for isolation? And if people seem to be violating quarantine regulations, partly because the thinking behind isolation has not been explained to in certain places. So whether we have a plan to increase quarantine centers and medical support, because right now the Sri Lanka's healthcare system has always been considered a good one, but it's at breaking point, and it has gone well beyond carrying capacity, as we know. Because I have staff members who actually want to get a PCR done, and this cannot be done because it used to be easy. You can go and get a PCR test done at the private sector, but it is no longer possible. You need a prescription from a practitioner, and only then that you have to also inform your MOH in the area, and there is a long process. So obviously all these issues are there. The roadblocks are also increasing of late, and this happened only last week because our carrying capacity has been exceeded. So the living with COVID approach has clearly not worked in this country, and it also means that the state has not been responsive and has not got its act together, so to speak. So health experts continuously say that lockdown with a break of, say, you have an opportunity to do your groceries, which we had yesterday, 3 to 4 days, it doesn't get the results that you actually want because people are out there. And another 5-6 days, you will be having people going out. And this is not just about urban centers. I do not talk about only the urban centers, but learning from last year, what happened, and the first and the second waves, whether we have actually created a reliable distribution system, a more responsive healthcare system, and thirdly, we are unable to there is no vaccination that's possible in the private sector. So private sector hospitals do not have the service. This also means those who are able to pay and would be willing to pay also do not. It doesn't mean that there should be a difference between the haves and the have-nots. But every country, even poorer countries, have much better systems in place to ensure that there is an opportunity for people to get vaccinated, and this is something that needs to be addressed. And the reliance on unscientific solutions has been one of the key things as well. So we've been promoting various things like it is not a critique on tried and tested traditional systems of treating people for infectious diseases, Ayurvedic and other various native treatment systems, but we have overdone it. There's been an overkill. There have been people, drinking up concoctions from various people. So you have a community of fake doctors, faith healers, and all kinds of practices that are connected to culture and religion being promoted over a vaccination program, where the reliance should be and the focus should be getting more people vaccinated so that and to prepare them, because as Ranjit said, this business of herd immunity, that doesn't work that way. And the more people getting vaccinated and more awareness being available, being created, would be the way forward for a country like Sri Lanka. Because if you look at statistics, Sri Lanka's rate of infection is really, really high. And a lot of people think about India and worry, but people really should look at Sri Lanka and have the same level of concern, because Sri Lanka is obviously not managing it too well at this moment. And also the culpability and in terms of information control. Information is really very important at a time like this, because information can save lives. So there are various mechanisms to control information that is very important to people, instead of having the kind of expert information being relayed to people for them to understand how does this virus work, how can we get affected, how can we be protected. And with all these reports about 6 variants being recorded in the country, and then of course the black fungus, there is disinformation, there is an infodemic, and that's more powerful than the real information reaching people. So the concealing and the culpability of, concealing the culpability of sometimes big businesses. This happened last year, and right now it's happening. So some of these reports are also not coming out because, for example, the apparel sector. There was a famous apparel company last year. The second wave was linked to that, and the stories were largely controlled, and there was enough evidence to show that there was a huge PR campaign to show that these are companies that contribute to Sri Lanka's economy, and therefore you should never question their standards of sanitation and how they maintain the workplace safety. So these are issues that that are really important for Sri Lanka, and it is once again very important because similar things are happening right now. So not doing a proper calculation and forecasting after the first wave and preparing the ground to deal with increasing numbers or a second or a third wave, and getting ready seems to have been one of the things, being among the things that Sri Lanka seems to have failed. I'll stop there, Sonny, so that we can speak in the second round.
All right. Thank you so much, Dilrukshi. Thank you very much. Before I go on to Surendra, this is just a very short 1-minute video on Nepal.
Seven Summit trucks have around 1,000 bottle. When the empty cylinder is come here, we can provide this cylinder to our government, and government will make a refill for medical oxygen.
Thank you. Surendra Phuyal was a former BBC correspondent, and he worked also for publications in the United States. I got to know him through IPS. He was our Nepal correspondent for IPS when I was IPS Asia Pacific editor. It's a pleasure to have him today. I've been trying to get him to talk on various webinars on South Asia, but he's always been really busy, and today he's gracefully accepted to be with us. Surendra is also doing a lot of community work in this COVID response in his country, Nepal, and he'll talk a bit about that, on how he's trying to form this network on trying to get oxygen for severely ill patients. So over to you, Surendra. Thank you.
Thank you, Sunny, and hello, everybody. Thanks for having me. When I'm speaking to you on this webinar, we are dealing with a very serious humanitarian crisis in Nepal because of, as you know, COVID-19 and the second wave, which caught everybody by surprise as it, got transferred into Nepal from India. The new Indian variant is considered very complicated and very deadly, as it is, as you have all seen in India and seen in news reports related to Nepal. The main reason for where we are today is the open border that we share with India, civilizational ties thanks to that, and we have 1,800 kilometer long open and porous border, which is used by people from both countries to travel across each other quite freely. All they need is an ID card. And a lot of Nepali migrants work in India. A lot of migrant workers from UP and Bihar work in Nepal, and they travel quite freely without much check and surveillance in these times of pandemic. And when things got worse in North India, they immediately started getting worse in Nepal too. Nepal took precautions, but it was quite late. People were complacent. Leaders were complacent. People were organizing weddings, social gatherings, and all of that. And political leaders were organizing political meetings, mass meetings, and nobody was stopping them from doing that. Even though cases were already going up in India, people were not cautious. Leaders were not far-sighted, and that resulted in 8,000 daily COVID cases, 8,000 daily infections, and almost 200 daily deaths throughout the month of May. Started from almost 1st of May, when the country into lockdown. Much of the country went into lockdown starting early May, but then that was too late. A lot of Nepali leaders and religious leaders, including former King Gyanendra and Queen Komal, attended a super spreader event in North India, Haridwar, where Mahakumbha Mela was organized. And former King Gyanendra and Queen Komal and a lot of others came home with coronavirus infections. And migrant workers from Mumbai and Delhi and Lucknow and all those places came home with infections. And even though there were antigen tests and things like that, the virus just spread across the country, from towns to villages in the hills and mountains. So now almost every district in Nepal, out of the 77 districts, almost every district has coronavirus infections and cases, and deaths happening all around. The government is still not clear when it will lift the lockdown, because the crisis is still there. And when cases started growing, when hospitals started getting overwhelmed, There was clear shortage of oxygen cylinders in hospitals, and Nepal needs oxygen, Nepal needs vaccines, started trending on Twitter also, although Twitter is used by a very small section of the population, so-called social media elite. But there are other people who have no access to social media, who have no access to internet, and they are still facing oxygen crisis. We were supposed to get help from India, but again, India itself was, mired in a deep trouble crisis, and Nepal turned to China, and thankfully some cylinders, some hundred, some thousand cylinders arrived from Beijing. Some came overland across the border. Some cylinders came from Gulf, specifically Oman, where Nepalese working in the Gulf and the Middle East gathered oxygen cylinders for their countrymen back home. And oxygen cylinders were also flown from Oman. And there was a aircraft that came from Spain a few days ago, and it was supposed to take back the climbers and trekkers who were in Nepal. They were stranded because of the lockdown. The aircraft came, the chartered aircraft came with oxygen and other medical supplies from Spain. Another supply came from Europe, Switzerland. So these are the kind of assistances and help Nepal is currently getting, and the government has, although it said the Prime Minister KP Sharma Oli initially said that things are under control, but he was severely criticized for saying that, because things were not actually under control, and people were gasping for oxygen, patients specifically, and the situation has not changed much for people. Now things are showing some signs of improving, but again it's very negligible to consider it significant. The humanitarian crisis is very much here. It still remains pretty much the same, and media is playing its role. All leading media houses have given prominence and top priority to issues related to COVID-19, management of the crisis, of the pandemic, oxygen supplies, oxygen shortages, stories of people affected by COVID, stories of patients, their relatives, stories of people rendered jobless by the pandemic, and things like that. So media is doing a great job. Also, there are a lot of community volunteers who are active in social media, like me, who try to join several groups, help groups, and try to pass on the message: who needs oxygen supplies, who has plasma, therapy, who has plasma blood required for plasma therapy, which is still being done in Nepal, although scientists say it is not going to be very, very effective in treatment of COVID-19. And things like that. Oxygen supplies, food supplies for people who are hungry and needy. There are several volunteer groups on Facebook and Twitter and other social media platforms where people have joined and are trying to spread the word around and trying to help. Also, if needed, to go and visit people, affected people in person, and ensure them help and things like that. In Nepal, journalist community itself is affected by COVID-19. According to Federation of Nepali Journalists, an umbrella organization of working journalists in the country, over 600 people, journalists, were affected by coronavirus. They were infected at least, and at least 6 or 7 of them have died, according to FNJ. But again, that these figures are not updated, and I think the numbers should be much higher once they are updated. And Also, because of the pandemic, businesses are down, advertisers are down and away, out and away, and they are not giving the advertisements to the commercial media. So there are a lot of concerns amongst journalists, about losing their job or even getting their salaries on time. So there are concerns about the future of corporate journalism, salaries and things like that. And still they are trying their best. Journalists across the country are trying their best, and even if they are COVID positive, if they are capable of doing it, they are doing it. They're supplying news and information surrounding COVID-19 and the pandemic. And everybody's hoping that things will get better soon, in a couple of weeks' time, as authorities have, imposed a lockdown, and probably that will help break the chain of the spread of the virus. And that's the only hope everybody is harboring in Nepal. Thank you.
Thank you very much, Surendra. That's really very touching and spot on. And thank you also for touching on the dangerous situations that Nepali journalists have to endure to get the human side of the story out. Next, we have Shameem Sheuli. Shameem is my colleague in Dhaka, Bangladesh, and she's the program manager for Internews. Both Shameem and myself, we work very closely in organizing safety programs for journalists in Bangladesh, and we worked. Shameem worked very closely with the DART Center. We have Amanta Pereira from the DART Center also with us this evening, and after this he'll talk a bit about what the DART Center is doing to help journalists. Shameem is the program manager for Internews in Bangladesh and works across a whole range of topics from health journalism to gender issues to livelihood issues. Yeah. So on to you, Shameem. Thank you.
Thank you, Tony, for having me. Good evening, everyone. I will more discuss the current COVID situation in Bangladesh and mainly the risks and the challenges media and journalists are facing while reporting this situation in Bangladesh. So when the last report came in, according to World Health Organization, Bangladesh reported 1,441 new cases and 25 deaths due to COVID-19 in the last 24 hours. So if I compare these numbers to the last month's statistics, it would appear that Bangladesh is actually getting better. The COVID situation is getting better, but some facts and new developments indicate otherwise. I mean, since the first COVID-19 case was identified in Cox's Bazar in March 2020, the Institute of Epidemiology, Disease Control and Research, IEDCR, has detected 5 variants of COVID virus variants in Bangladesh, with the Indian variants being the latest. The other variants are the UK variants, South African variants, Nigerian variants, and Brazilian variants of the coronavirus. But on the 17th May, IEDCR confirmed that they found Indian variants in samples collected from Dhaka. Media also reported that Indian variants have been detected in 2 border districts, Chapai-Nabganj and Jashore. And the day before yesterday, the government enforced a 7-day strict lockdown in Chapai-Nobgons, one of the border districts. It is very funny, but because we are already in a lockdown, so it is like lockdown in a lockdown. After Chapai-Nobgons reported an alarming 55% COVID-19 test positivity rate. I mean, despite we are having a nationwide lockdown, and it is until 30th of this month. So this is really scary. I mean, according to the health experts, due to cross-border movement, reckless travel during the Eid holidays, and an increase in face-to-face business transactions due to mango season in Russia division, especially in Chapai-Nobgons. I mean, we are witnessing this sharp rise in Chapai-Nobgons. And these experts believe that if genome sequencing of COVID-19 samples from these districts, we will see that Indian variants will be the dominant variants in this district. And besides, I mean, today's media reported that we have detected a black fungus case in Khulna too. So considering all these, I mean, facts, experts believe that Bangladesh has a reason to fear. Maybe Bangladesh will face the SARS of COVID-19 that's sweeping through South Asia. And this is not the first time that experts feared of a catastrophe in Bangladesh. I mean, before this pandemic broke out in Bangladesh, experts feared that Bangladesh may face a serious crisis because the large population, which is very, I mean, we have the very densely, and they are very densely populated, and Bangladesh doesn't have like a strong health infrastructure. We have very poor health services. So there was a fear that we might face a catastrophe like what India is going through right now. But fortunately, we didn't see that happen during the first wave of pandemic. I mean, until the March 2nd week. Before March, the infection rate was really very low. It was below 5% for about 2 months. But the situation began to change in the second week. We witnessed a sharp rise from around 9% to almost 19%. And it continued to rise in April too. In April, we witnessed that average infection rate was above 4,500 for weeks, with like 7,500 on a single day. And we also witnessed 100, I mean, death rates above 100 marks for at least 4 days in a row, with 112 deaths on a single day on 18th of April. So this situation led the government to enforce a nationwide lockdown on April 14th of April, the Bengali New Year, and the government extended it several times as the fatalities rate kept rising. And for a while, I mean, in the first week of May, it seemed that the situation was really improving because of lockdown. Therefore, the government just lifted the transport ban around the country. And then, I mean, this development just occurred. Like we are watching that Indian variants are found in Dhaka and other districts, and rising numbers of cases in Chapai-Nobgons. So this is really a scary situation because still there are a large population are not taking this health risk very seriously, especially people outside Dhaka. They are not wearing face masks, do not wash hands or sanitize or follow social distancing. As Joya was sharing some incidents in India, like there are elections, religious gathering. Same thing is happening in Bangladesh. Even people are, taking parts in wedding. They are organizing parties. I mean, they didn't, follow the transport ban. They risked their life and traveled during the Eid holidays. So we don't know actually what is waiting ahead. And reporting this situation is really very difficult for media and journalists. It has always been very challenging and risky for journalists since the pandemic hit Bangladesh, because first, it has changed the pattern of news coverage drastically. I mean, in Bangladesh, political events, protests, crime, accidents used to make news. But since the pandemic broke out, all of a sudden, health crisis become the center of the news coverage. And health reporting or science reporting was not a regular beat for many media houses. So there has been a lack of skilled reporters who had technical knowledge for reporting health crises like COVID-19 pandemic. And besides, maybe Dilrukshi, she was mentioning about the infodemic. There were so many misinformation, disinformation, rumor, even debates among experts surrounding the COVID-19 sources of infection, symptoms, remedies, treatments, offline and online. Those actually, even confused professional journalists. And this confusion and this dilemma mounted when the government of Bangladesh imposed restrictions on providing data. In last year, in May, the government issues a series of directives for public servants, including health officials and doctors, asking them not to talk to journalists or media. Of course, they assign some people as a spokesperson, but they would not talk to journalists or media the other way they do. They only talk to them, at a press briefing, which is taking place online. And this is not enough for in-depth reporting. And the most difficulties faced by actually journalists who work at district or regional level, because there are not many experts or spokesperson in the local or regional areas. So who do they talk? Of course, journalists have their own sources, government officials and experts. They would give them information off the record. But this is very risky for Bangladeshi journalists or media to write about it or publish unless the authority or government approve it, because there are legal consequences. Bangladesh has Digital Security Act, which has been utilized against several journalists during this pandemic who exposed corruption in health sectors or criticized the mishandling of COVID situations. And the latest, there is a female journalist who is an investigative journalist who exposed several corruptions of the health ministries and other sectors. She was physically assaulted last week at the Secretariat and later prosecuted under a colonial act, Official Secrecy Act 1923. She has spent 5 days in prison because at the first hearing, she was denied bail. So now she is on bail, but she is physically, very sick, taking treatment at a hospital. There are more examples, like this is not only the journalists, also online activists, Mushtaq Ahmed, an online activist who died in prison in February. He was denied bail for several times. He was prosecuted under DSA for criticizing governments on Facebook. However, the latest arrest of the reporter Rosina Islam, who worked for the most circulated Bengali daily in Bangladesh, sent a strong message to media and journalists. The experts fear that this will lead editors and journalists to more self-censorship. It is a blow to press freedom and investigative journalism in Bangladesh. Journalists will be less willing to dig into deep for reporting, who are already facing so many threats, including physical and financial threats since the pandemic hit the Bangladesh. And another challenge is for media and journalists is media and reporters are missing human side of the stories because of the physical threat of getting infection. Mainly journalists who are working in district areas, who are the district correspondents working print, online or television media, they are actually covering the stories from the fields. Although they are facing huge challenges and physical threats, and they are on their own because their houses are not providing providing with protective gears or providing any extra financial supports for covering these stories. And the statistics about infection rate of journalists and death tolls is not negligible. According to an online platform of media and journalists, until 23rd of May, 1,367 journalists in Bangladesh tested positive and recovered. And 38 journalists died due to COVID-19, and another 14 died with symptoms who did not test. But we are guessing that they died due to pandemic. So these are only actually, the counted numbers. There may be more that has not been reported. So we do not have actually the exact number. And so if situation get worse, as a frontliner, journalists are really in huge risk, because since the since the pandemic, when the first wave swept over the country, like many citizens, journalists and media were panicked, and they took some measures like big houses. They let their reporters work from home, cover stories on the phone or online, which were taking place virtually. And some other media houses made some other arrangements that they were working with minimum staffs in shifts, and sometimes they were actually providing like PPE and hand sanitizer, masks, who were covering stories physically. But over time, when situation little improved, they got reluctant. So this is really, a scary situation, because they are not prepared to face a surge like India is now experiencing. So media houses have to actually realize the threats and should consider all the possibilities and have to plan ahead so that they can face the situation. And as media houses in Bangladesh are not, I will say, that very financially viable, who have or who could afford support their staffs. So journalists, associations, and journalists personally have to take care of their selves to keep them safe from COVID-19. Before I end, I will also like to um, point out some other risks besides the health risk journalists are facing. Um, Journalists and media in Bangladesh are facing serious financial crisis. I mean, during the first wave, a number of small media houses or regional media outlets couldn't survive. And also some big media houses use the job cards, uh, like Prothomalo, and which is one of the most popular media house in Bangladesh. And I can also say, name like Jano Control and some other organizations. They were terminating their staff, saying that they are facing financial crisis. Hundreds of journalists lost their job. So this is, also another risk journalists are facing. So they are under a lot of mental stress. I mean, while we were organizing some workshop with Dutch centers and ICRC, they were actually sharing their fear and stress. So this is a area maybe media and journalists, CSO or organizations who supports can think that if they can help journalists to overcome this stress and fear, that will be really very useful. Thank you, Soni. Thank you, everyone, for your patient hearing.
Thank you very much, Shameem. And keep the questions coming in. Drop it into the chat box. And thank you to all the speakers for the first round for keeping to your time. I'll just summarize the discussion so far. I think there are common themes arising from India, Sri Lanka, Nepal, and Bangladesh. Number one is that there's a certain degree of government complacency, and where politics and electioneering takes precedence over public health security. And number two, also there's a certain degree of complacency among the public, very much attributed also to the governments and the authorities, giving them a false sense of security. The virus doesn't know borders. The virus doesn't know that it has to be contained in India. It can just spread to Nepal, spread to Bangladesh, spread even to Sri Lanka. And all the speakers have brought out that it's not the variant B.1.617, which originally came from India, that's circulating. You also have the B.1.1.7 originally from the UK. You have the South African variant B.1.351, and also you have the Brazil variant, the P1 variant circulating. So it's not just one variant, but a combination of variants. And also Shameem, I think, was saying that there was also a variant that was first sequenced in Nigeria that's also circulating in the country. So it's a complex situation, but we just can't blame variants for the surge in cases. There's a certain amount of responsibility too. And what was also brought up by Ranjit and also Surendra and Dilrukshi was the lack of data to make decisions. And there's certainly a data gap. Shameem brought out the case of Rosina Islam. It's very disturbing that she could probably face the death penalty for breaching the Official Secrets Act, which was in place during the time of the British colonial times. And this has caused fear among the journalist community, among editors, senior journalists, to resort to self-censorship. And also in the case of Bangladesh, the surge in cases too have been caused by the relaxing of the movement of people during the Eid holidays. So these are all contributory factors. And I can say personally that all the panelists have been affected by COVID. Either they themselves have got sick and recovered. The close ones got sick too, and they've been involved in looking after them and caring for them. And also they've seen their colleagues fall sick. So it's taken a toll on them. And this is just the tip of the iceberg. How many other journalists are undergoing stress, trauma, and not being able to deal with it because the whole system is completely overwhelmed. So without much ado, I'll call upon Amanta Pereira. I think those of you who come from Sri Lanka will know Amanta. He was with IPS, and he was also one of the foremost journalists, mentored by the late Lasanta, whom we all miss very much. And Amanta is now working towards his PhD in Australia, in Melbourne, and he's also the Asia Pacific coordinator for the DART Center for Trauma. So on to you, Amanta. Thank you.
Thank you, Sunny. So a little bit about the DART Center. The DART Center is based at the Graduate School of Journalism at Columbia University. And it is the foremost organization that works with journalists and trauma. The unique nature of the DART Center is the fact that it brings together trauma experts in terms of clinicians and other medical experts, and also journalists and journalism educators. So when I would do a session with on behalf of the DART Center, I would not be working alone. I would be working with a colleague who is either the clinician or someone who comes with a much more of a medical background. I work with the DART Center Asia Pacific. I work as the DART Center Asia Pacific regional coordinator. So my work involves a lot of dealings and coordinating with colleagues in the Asia Pacific. Before I go on to say what we do with regards to the pandemic and the expertise we provide for journalists, a little bit about what we've seen as trends that are emanating from the pandemic. One of the things is that I think most of the speakers alluded to this. This is nothing like we've seen before. There is nothing that we can go back to and learn lessons and bring it back to what's happening right now. One big example here is that in any other past disaster emergency story that journalists have covered as individuals and as a community, there has always been a certain differentiation between the physical threat that you face and the kind of mental threats that you face. In this case, the differentiation is almost minimal. There is this overlayer of the physical threat of being infected, and then there is this other layer of the various levels of mental threats that they face. Another key point that we've seen is how online trauma threats have come to the forefront. Journalism has been pivoting to online resources for some time, for about 20 years, 25 years. But in the last year and a half, what we've seen is that online resources have now become the foremost resources for journalism. When I say journalism, this is gathering information, this is disseminating information, and audience engagement. So these are not new, but their influence has grown exponentially in the last year or so. Uh, Journalists are facing these vulnerabilities very, very intimately as individuals, and they're also facing these vulnerabilities as communities. So there is no safe place. Just imagine that we were covering a natural disaster like the tsunami that affected my country in 2004. Now, even with such a huge disaster, or even with a civil war, there was always a sense that you could find a safe haven from the dangers. In this case, there is nothing like that. And that's something really, really new that we've been dealing with. And also, the stresses that we are talking about that come or that get highlighted with the pandemic, they come on top of other stressors. Now, we just heard about Bangladesh, where there is this restrictive environment on journalists. In Sri Lanka, we've seen in the last 2 years a certain regression in terms of media freedom. It's almost as if there is a sense of self-preservation that's going on within the Sri Lankan media, where you look over your shoulder before you report. Now, on top of that, now you have a pandemic, and now you also have authorities who are trying to stage manage the pandemic for political expediency. So these are multiple threats coming on top of each other, and it creates what we feel a certain sense of entrapment. And this entrapment is highlighted and amplified by the fact that we all have been locked down one time or the other, and some of us are in lockdown right now, where physically our mobility is restricted like never before. And because of that, we physically feel that we are entrapped. And that actually amplifies the levels of threats, the levels of trauma, potential trauma dangers that we feel. Now, what does the Dark Center do? So we at the Dark Center Asia Pacific, we provide expertise and skills for journalists to identify trauma threats, and they could be physical threats, they could be trauma threats emanating and linked to physical threats. They could be threats that we are talking a lot about now, which are online trauma threats. We provide skills to identify them. We provide skills to mitigate them. And what we do is that we build resilience within journalism communities and individual journalists so that they can keep doing their work safely and much more professionally than before. Because trauma impact denies journalists of self-expression. So at the end of the day, trauma impact is all about media freedom and freedom of expression. With the pandemic, and specifically related to work that we've done in the region, we've done regional workshops with journalists from the region. We've done country-specific workshops with journalists from the Philippines, Bangladesh, Cambodia, Thailand, and Nepal. We are in touch with individual journalists who seek our help, our assistance to continue to work. Right now, I am in touch with several colleagues in India and other parts of South Asia as well. We are in the process of planning a workshop tailor-made for Indian colleagues. So the Dark Center does this kind of work, but we need time to plan out a workshop. And there is nothing that says one size fits all. What we do with an Indian cohort, we can't take it lock, stock, and barrel and do it for a Sri Lankan cohort. Likewise, what we do with the Sri Lankan group cannot be repeated with a Nepali group or a Bangladesh group. So we need time to put a program together, and there is no quick solution. What we do is we start a process which is long term and which takes some time to take effect, because trauma sensitive, trauma literate journalism is actually about changing the way that we work, changing the way that we have been used to work within a media ecosystem. In the media ecosystem that I grew up in Sri Lanka, the emphasis was on bulletproof journalism. We covered a civil war for well, about 30 years and all that. And it was about journalism. Journalists don't get affected. They're bulletproof. They're supposed to look at these nasty things and report about them and not to get affected. Now, that doesn't really work. Now, in my case, I have to actually break that mold and reinvent myself as a journalist to become much more trauma sensitive. So, in effect, it's a very long process. And we need time, and we also need other resources in terms of financials and technical resources to put a workshop together. But we do that, and if journalists or journalist organizations approach us, we do that. And if you want, I will put the links to the Dart Center. You can go and have a look at the tip sheets that we put out. But if you really need more, you can always contact us directly, and we are there to provide the skills that we are actually in a position to do. Now, finally, one more thing that I need to add is that one of the things that the pandemic has also done is this renewed attention on mental well-being. Now, this is not only within journalism communities. This is in general. There is a lot of emphasis about mental well-being, how safe we are, work-life balance, all that. Now, that's something positive that has come out through the absolute mess that we lived through in the last year or so. So in journalism communities, there are lots of dialogues about this, which is a good thing. Now, the danger here is that we've seen that a lot of self-proclaimed experts going out and talking about trauma and journalism. Now, trauma and journalism is a very new field. It's a new area of expertise, and there are very few experts who come with the type of knowledge that is required to train journalists to work with journalists. So the one thing that I asked for, which may probably sound like PR for the Dart Center, and which probably it is that if you are bringing together colleagues and others to talk about trauma, please make sure those who are leading the conversations are qualified, have the experience to do this. I have seen journalists lead discussions and say, I've had PTSD. Now that is something that you should never say. So please kind of pay attention to that and start the conversation, but do so with people who are qualified to do that. And finally, the work that we do as journalists is life-saving right now, because whatever that we put out as journalists or whatever we don't put out as journalists is going to save a life of someone we probably know. So our work is probably really vital now than ever in my lifespan. And I have covered some really dark phases in my country. I covered a civil war, I covered a tsunami, I covered the death and murder of my own editor. So we need to take care of ourselves. We need to take care of ourselves physically. We need to take care of ourselves mentally as well. And none of us are physically or mentally capable of doing this 24/7. We need to hit that balance. We need to create those little cutouts that allow us to have that balance. And what the Dart Center does is that we provide the skills, we provide applicable skills that journalists can use in their day-to-day lives. I'll put the links and the details on the chat books. And thank you very much and good luck with everything that you do.
Thank you very much, Amanta. And now we are into the Q&A session. And the panelists and those in the audience, if you have any questions, do drop them in the chat box. So before we go to the questions, I'd like to start the ball rolling. I'll throw a question to Surendra. And right now, technically, you don't have a government. Or am I wrong in saying that there's been a vote of no confidence on the Prime Minister, and the Parliament has dissolved the House? So what's going to be the next steps in the whole COVID response, the whole COVID emergency response in Nepal?
It is wrong to say that there is the government isn't there. There is no government. The government is there. It was in crisis, political crisis. KP Oli faced a vote of no confidence. It all stemmed after he dissolved the parliament 6 months ago. The Supreme Court reinstated that, not parliament, but House of Representatives, which is one of the houses of the parliament. And then he dissolved that yet again, and paved the way for elections. He did it unilaterally, and that's what made Nepal's politics so dirty looking for the critics. The government and KP Oli is still confident that he's doing his best to handle the crisis, but opponents are saying it's not true. And what is true is that this political crisis did play a role in aggravating COVID-19 crisis, and the government is now busy pulling up its shocks and trying to manage the crisis. But one thing is for sure, that political crisis, which is still there in Nepal, did play a role. If KP Oli government is not there, because his latest step has again been challenged by opposition lawmakers who knocked on the Supreme Court's door yet again yesterday. And in one scenario, the House will be reinstated again. In that case, there will be an alternative government. The government is very much there, but the politics did play a role in making matters so worse. And now the government is saying we are trying to do our best to abort this crisis, and they are also calling upon friendly nations, international community to help. And hopefully this will help.
Thank you, Surendra. Now we go on to a question from Vishy, and he submitted a question yesterday. And I think I'll post this question, two questions actually, to the panelists. He said he had to drop out of a 20-day assignment from an INGO, international NGO, because of several doubts. Number one, he's asking, do we have any COVID protocols for journalists while covering stories from the ground? And number two is that what are the ethical questions of presenting facts and figures from the ground in the light of a gap between what is reported and what is not? I think, Ranjit, you brought this up in a serious lag of data put out by the Ministry of Public Health, and data uh, which is also available in the States. Sometimes it just doesn't add up, and maybe Dr. Jaya too. You can fill in on this on this dilemma that Vichy is facing. Yeah. So so the first question is COVID protocols for journalists covering stories from the ground. Maybe Jaya, you'd like to
Can I say something?
kick it up? Yes, yes, Ranjit, go ahead.
Yeah, please allow me. See, the government has very strict rules regarding coverage of COVID. They warn people that if they take data or information from any sources other than government sources, they can be arrested. So that's put a scare in the media, number one. So you find them replicating all the wrong information. And in any case, the media has been a very compliant, very complicit partner in the whole government enterprise anyway. It's a compromised media that we have now. So that's because of the linkages, the corporate owns the media, the corporate's friendly with the government, and therefore the corporates want journalists to write what supportive of the government actions. So kind of a nexus. So independent journalism has been used in India doesn't exist anymore. But I think that putting out wrong information from whatever source, including the government source, is a disservice to society. And we need to know what's going on. We need to know what, I mean, if you look at it, the plasma therapies, they've been, now withdrawn, remdesivir, God knows, hydrochloroquine, the whole variety of treatments and misinformation the government put out itself. It's the ICMR that put it out. So now the media, well, maybe they exaggerate it a little bit more, but they want current things with the government. So the end result is that they're fed with so much bullshit. I mean, you look at this mucormycosis case, the what do you call NITI Aayog, the successor to the planning commission, actually denied. Mr. Paul actually denied that there's any danger from anything. That's all wrong, bullshit. I don't know if they're qualified to say anything either. And suddenly they had many states began to report this, and they had to make it a notifiable disease. And now, well, it's you're talking about even in Delhi alone, there are hundreds of cases of mucormycosis. And it's not just mucormycosis. Let me tell you, you have candida, you have other nosocomial hospital source infections. It's because of maybe the rush of patients with the hardly any trying to fumigate or sterilize the wards, including the ICUs. So it's a mess out there. We already, and then on top of it, you have antibiotic resistance. If you talk about candida, it's become resistant to the best antifungals going. I know I did a story on candida. And suddenly it's a bug that came out of nowhere. And they traced to the Andaman Islands some time ago. And it's something that no hospital has any answer for. So now on top of it, you're talking white fungus, you got black fungus, you got I don't know what. And the use of steroids, well, I don't know. I'm not a medical person, so I cannot say. But a lot of people say that it can be dangerous to start off people on steroids too early, because then you become you're obviously the immune system gets suppressed, and like Dr. Jaya said, your sugar levels rise, the ideal conditions to breed fungus, and so on. So misinformation, disinformation. I just don't know. On top of it, they have these red herring kind of things. People deliberately, somebody condemning allopathic medicine, promoting Ayurvedic medicine. The government itself promotes Ayurvedic cures, homeopathic cures. So I mean, the ordinary person is just bewildered by this tremendous amount of information and misinformation going around. You don't know what to think. Even the doctors, this plasma therapy was debunked last November by ICMR, the Indian Council of Medical Research. But doctors continue to prescribe it and patients continue to demand it. They want, there's a window in which you can use plasma therapy to some extent. But for patients to be demanding it and for doctors to, to accommodate them is it's too much. Now of course, it's they've cut down. Anyway, Dr. Jha, I'm so sorry for interrupting. Please go ahead. I'm sure you can talk much.
Not at all.
Jaya,
Yeah.
up to you now.
Yeah, not at all, Ranjit. I think you bring up very, very valid points, and I think that the way you express them is also reflective of the enormous tensions we're going through. Just a word on the data and journalist complicity. That's a very interesting point that Ranjit made. Early on. In the beginning, just before the vaccination initiative was to be rolled out in India, journalists were sort of co-opted, shall we say, into a very, very well drawn up, actually, vaccination communication strategy. Journalists were trained on, what to say, what not to say, to clarify the position and about the efficacy and what would be available, how many doses, and all the basic public health messaging was very effectively done by journalists, as was all the stuff about how to stay protected and how to stay safe. All this was going very well up until the first wave and then the beginning of the vaccination rollout. And then after March, I think that everything went haywire as, electioneering started, the Kumbh Mela came along and other gatherings went on, the pandemic got out of control. And then, the media, I think at that point in time, I mean, Ranjit, correct me if I'm wrong, you began to see a medicalization of the pandemic to a large extent, where the journalists became, turned into just sound recordists and interviewers. So we had no independent analysis by journalists, but we were relying on what, medical experts. There is a, standard set of talking heads that we see on television all the time. And some of them were giving guidance that was at variance with the ICMR guidelines, which were at variance with the WHO guidelines. So just to keep in mind that, to be kind to the media also, it's not easy to keep up with the changing guidance that is being issued at a global level as new scientific evidence comes in. So we're literally scrambling to keep up with the changes in the guidance from, ditching hydroxychloroquine to then ditching plasma therapy, then to ditching remdesivir and ivermectin next. And in the meantime, by the time that guidance filters down to, AIMS or whoever is formulating the national guidelines, and then from there to the media, who already then goes ahead to broadcast it, and then the local language media, which then takes it down, and then the social media, by the time the guidelines have changed at the top again. So in the meantime, there's all these unscrupulous people who sort of exploit the gullibility of people, saying that remdesivir works and ivermectin works, and we've seen a mad scramble for these drugs that are completely useless and have been sort of clearly described by WHO as okay for clinical trial use at the moment, but not recommended for large-scale public use. So I think there's a lag in the information flow that's very, very hard to keep up with. And that's going to happen. That's going to keep happening as newer drugs come along and the older drugs are, either, taken out of the recommendations or kept in some form or the other. And that's something that we'll have to continue to sort of stress about and learn about and so on. I think it's important at this point for journalists then to keep an eye on three major things. One is go to the websites, exactly as Amanta was saying, it's now the age of where you have to constantly keep updating yourself through the online access that we have to the WHO and the other global bodies that are laying these guidelines down. Go there and check to see what's at variance with the AIMS guidelines or the ICMR's guidelines and with what the doctors are saying, and say that in our news reports. We just have to point out, we're not the experts here. We can only say that this is at variance with this, and what is the final thing, and we can report on the opinion. So that's, I think, to do with the data and the lag. And Ranjit, thanks for flagging up those really important points. Just a couple of lines on COVID protocol in terms of you talking about safety of journalists reporting from the front lines. We don't have anything other than the four classic things: the vaccination, get vaccinated, both the doses at the appropriate intervals, which, by the way, guidance is also changing around those things for different vaccines of different efficacy, dealing with different variants. Not at all easy. We have to do the dance as best as we can. Just take what's available before you go to the field, wear the mask, continue the hand washing and the sanitizer, use, and don't touch your mouth, nose, and face, and practice physical distancing as much as possible. I think this is the protocol, and if one is going to, try and dig up stories, the truth behind undercounting of deaths, I don't see how that's going to happen without us going to the field, going to these crematoria, going to these funeral homes, or following up in rural households to find out how many people have died. And that's a huge risk that we have to take. So what should we do? I mean, that's the dilemma really here. And now I'll, sort of hand it back to you, Sunny. It's a lot of hard choices. We're going to have to, we're going to be forced to face a lot of emerging, evolving issues for which there are no clear answers, and we're going to be putting ourselves at risk. So I think to start with, let's get vaccinated and then try to, sort of keep our sanity. Back to you,
Thank
Sunny.
you. Thank you very much, Dr. Jaya. Before we wrap up, Dr. Jaya has an important announcement, and she'll close this webinar. I'd like to address each of the panelists, from Ranjit, Surendra, Dilrukshi, and Shameem. Is Shameem still around?
I am, Sunny.
Okay, yeah. So you've got like, a brief answer in about a minute long, not more than 1 minute. Is there light at the end of the tunnel in your countries with regard to the COVID emergency response in during the second surge, or for some countries in for instance, Sri Lanka, the third surge? Is there a light at the end of the tunnel? Will the number of cases come down, or can they come down, or is this something that we have to live with? Ranjit, Surendra, Shameem, and Dilrukshi.
Tony, I don't think that we are end of the tunnel of the second wave. As I mentioned, that considering some, facts and the latest situation for a while, to, think that are we over the second wave, or is there anything that we fear that maybe Bangladesh will be the next country is going to face the surge? So we have to wait at least until this month, then maybe we can, can get the idea of what is actually coming ahead.
Thank you. Ranjit? Ranjit, unmute yourself. Ranjit, we can't hear you. Can you unmute yourself?
Can you unmute it? Yes.
Yes.
Yeah, we can hear you.
So I think ultimately the virus will burn itself out. All viruses do anyway. But how long is that going to take? Because the minute you lift the lockouts, the thing is, in India, there's always prey for the virus. More and more people, a lot of people left either unimmunized or not directly immunized or whatever, So eventually, yes. But then the worrisome part is, of course, the mutations. Whether the vaccine is going to protect them or not. And we don't know how the government is going to handle, or so far they've shown no sign of any competence in handling this thing. Maybe if they listen to good advice, climb down to their high positions, discard all this non-scientific rubbish, maybe. But we don't know. They get into all kinds. See, for example, one of the interesting things about this COVID thing is that the competition between China and India. See, here was a virus that came out of China, Wuhan, as you know. But the Chinese are very interested that you don't call it the China virus. They send a message to the Indian government saying that please don't call it the China virus, an official no. But the Indian media kept calling it the China virus or the Wuhan virus, and they were very annoyed. They can't understand that the Indian media is not an organ, or does not function as an organ of the government. So what do? I can't say it's related, but they actually launched almost walked on the border. So the Indians were bogged down with fighting the Chinese on the border. We don't know whether to flare up again because now we think there's been all kinds of propaganda, misinformation, conspiracy theories that maybe it was an engineered virus that came out of Wuhan. The Indian media is full of this. Just annoys the Chinese. They may not, be so angry with the US or the West. They may not be so angry with small countries like Nepal or Sri Lanka. They've got them anyway where they want them. But they are very annoyed with India. If you look at the media, the Global Times and everything, they go on saying how incompetent the Indians were. Look at them. Look, they created this virus and they're blaming. The whole global cooperation has simply collapsed. That is the problem I see here. That people are hoarding vaccines. People are competing. In your vaccine diplomacy, your vaccine wars going on, blaming each other. It's terrible. Of course, now, we have oxygen supplies coming from India. And yes, India has shared its vaccines with other countries, maybe to compete with the Chinese for whatever reason. They did have this concept of, but they don't have the wherewithal to do what they want to do. So let's hope they give up all this humbug and really look after, the problem at hand, which is because of India's large population, which desperately needs those vaccines. Because you can't allow this sort of a situation where, so many people overwhelm the hospitals. They can't take the burden. As I said, when I was hospitalized, the first thing I saw all those people out there. Just terrible. I felt guilty. Tell you the truth.
Thank you, Ranjit. Yeah, share your concerns. Surendra, what's next for Nepal? Pressure from China, pressure from India, pressure from within the country, pressure from the south.
We have to be optimistic. It's a very bleak scenario right now, but just today, now, as I speak to all of you, I'm reading a piece of news, which is sort of like breaking news, which says Chinese president has decided to give 1 million vaccine for Nepal. So aid is coming in, help is coming in. Virus is something that we did not create. Nobody knows how it came, except for the Wuhan story. And international help, helping each other, neighborly help will eventually help. And I hope herd immunity will be developed sooner rather than later. Coronavirus is here to stay. We'll have different forms and avatars. But eventually, I think South Asian communities will be able to, get over it and emerge even stronger. There is hope.
Thank you, Surendra. Dilrukshi, Rajapaksa government using money to buy luxury cars instead of vaccines. What's next? Can you unmute yourself, Dilrukshi, please?
Just want to add a footnote quickly to what Jaya said, and that's about journalists being safe and what should be done. I think institutions have a huge role to play. And I know our region does not have extremely rich media organizations. Some do, some countries do, and certain media houses are super rich too. And we certainly know where you find these media houses. But having said that, in Sri Lanka, we are demanding that in terms of a protocol, the institutions do develop a protocol of their own, and we have put up 4 key demands as to how you can provide personal protective equipment, and whether we can look at health insurance. These are demands from the journalistic community that at least this is the minimum you can do if you want this story to be told, and people are telling this story at great risk to themselves. So that's something I wanted to mention, and that we really need to work as a community within South Asia, and because we are not very different, to demand that these things are in place so that they may continue to do the work that we all need to see being done. It's a hypothesis that I wouldn't want to work on, Sonny, the question whether there would be any kind of light at the end of the tunnel. Each country will have similar but different answers and issues to deal with. Sri Lanka got extremely complacent after the first time. We were very arrogant about it after we dealt with it so quickly and a highly militarized solution, but things were put in place very, very quickly. And we thought it's going to last. What we did not consider or factor in was the fact that how virus can play out, and the fact that you need to prepare yourself, you have to brace yourself, you actually have to talk to experts and put experts in place to make these decisions and design programming, which is not happening right now. We are an island, we are not landlocked. This creates certain opportunities as well in terms of containing a pandemic. Probably this is why we were successful right at the beginning, and we should play to that. And I think for that you need to work with there are experts. Experts are saying that their voices are not being heard, that they are not given enough recognition and to develop programs. And one case in point, as I gave an example of, having a lockdown, and 3-4 days you have an opportunity, you just relax the regulations so that people can go out and do groceries, which means in the eyes of the experts, this is really not how you manage one. You need to prepare the community to go through that lockdown in a particular way, and you have to have a distribution system. It is not possible in bigger places like Bangladesh and India and Pakistan maybe, but Sri Lanka can actually, try and manage it because of the containment that is possible in an island nation with 22 million people. So I think it's about getting the act together, and if done, there could be some light. And on the other hand, I think it's also not just about governments. We have to demand accountability and responsibility from the state. As we do that, journalists and citizens, I don't make a huge difference right now, and I think we need to be literate. All of us need to learn. All of us have had to learn. All of us ended up becoming health reporters. All of us are compelled to become and serve as health reporters, all journalists right now. And it has been an extra stress on journalists to learn this new craft of, becoming a health reporter if you're a defense correspondent before. So along with that, citizens also need to update their understanding. Otherwise, how do we demand accountability from the systems that are supposed to be run on our behalf? Thank you.
Thank you very much, Dilrukshi. Very good points are made on transparency and accountability to the people. Yeah, very good points, which is very much needed, especially if you need community support to overcome this virus. Dr. Jaya now would give the closing remarks, and should also introduce us in a short statement in the new course that Internews has launched, very much to do with vaccines, and it's for journalists, and it's free. You're welcome to join it, and you get a certificate at the end of it. On to you, Dr. Jaya.
Thanks so much, Sunny, and thanks so much, Ranjit, Surendra, Dilrukshi, Amanda, and it's been absolutely, I think, a very, very interesting discussion. Also because of the sincerity of all the speakers and the involvement. This is something that we're in the thick of and trying to swim through this, and hopefully we'll come out of it safe. So I just wanted to quickly flag up that while we're doing a kind of a firefighting journalism right now, because we're reporting on an emerging crisis that's moving so fast, killing so many of our colleagues and people that we know, we also shouldn't forget that this is like a lesson that's unfolding in front of us. We have to take these lessons into the future when reporting about pandemics in general, because this isn't going to be the last one. We're going to be facing future pandemics of this nature that call for greater cooperation between the countries of the region, that have to factor in the politics, the science, and the governance aspects of it, as all the panelists have so beautifully sort of outlined. So I think we shouldn't lose the lesson that's being taught to us by the way we're dealing with this pandemic. That said, I'd just like to also introduce, and this course that Internews has launched just a few days ago. There are twin courses. The main one is on vaccines. It's called Let's Talk Vaccines. And you can learn it from the safety and comfort of your own home, sitting in front of your computer. It's a self-directed course, which has various modules, starting from the science of vaccines and immunity to the way they're made, distributed, vaccine confidence issues and where you can go to for sources of information to report on vaccines. So it's been written by journalists who've been reporting on the issue or thinking about it. And there's a sister course on Let's Talk COVID-19, which talks about the virus, about the origins, about the zoonosis, the diagnosis, treatment, prevention, as well as the impact. So these are like two sources that sort of go together. And we would very much like to sort of ask you to promote these courses, and please give your suggestions to improve them and make them better. There's a comment section under each of the modules that you're welcome to engage with. We've tried to make it as practically helpful to journalists as possible, and we look forward to your comments and feedback on these courses. So I think we've taken up a lot of time already, and so back to you, Sunny. Thank you very much to all the panelists and the lovely questions from the attendees for a really scintillating discussion. Thanks so much.
Thank you very much, Dr. Jaya. And the URL for the course is in the chat box, yeah? So just go to the Internews site and just go to Let's Talk Vaccines. Thank you so much to Ranjit ji, Surendra ji, Dilrukshi and Shameem, and also a special thanks to Amanta for making time. I know it's late in where you are in Melbourne, for taking time to be at this webinar. The discussion has been fantastic, and we hope to do a follow-up webinar on this second or third wave of the virus in your countries. Stay safe, be strong, be compassionate, and have faith. Thank you very much.
Thank you.
Thank you, Sony. Thank you, everyone.
Thanks,
everyone.
Ranjit, Surendra.
Thank you, also.
Bye.
Thank you.
Bye.
Bye, everybody.
Bye.